I wanted to start with just somebody from the report who is from the West Bank. Her name is Mona, and she is currently 27 years old, and she's from a well-known landowning family. She married out of her family, as is traditional, into her husband's at a quite young age, at 15, and by the time she was 27 she had 3 boys and 1 girl. She moved into a one-room house with her mother-in-law. When her father died, her brother came from the Gulf asking her to relinquish her inheritance, and she actually did do this. I think possibly through lack of information she signed a paper. She didn't tell her husband about this. He travelled to inquire about her inheritance, which he was interested in, and when he found that she had relinquished it, he returned home and cracked her head against the wall. She spent 20 days in hospital, but she didn't denounce her husband to the police. And instead, her brother came and denounced her husband to the police. Following that, their relationship deteriorated and she was divorced. And she did not have custody rights over her children and was denied access to them. She went back to live with her brother, and that didn't work out. And she had nowhere subsequently to go. She left their house. She had no real support networks, no safe spaces. She had to go back to her ex-husband and ask if she could be his domestic servant. So she began to work for him, and her brother again intervened because she was being exploited, had another fight, and she was thrown out. And by the end of the story, she is living working as an agricultural labourer with another old lady. So this list of factors, it sounds quite extreme, but it's actually not necessarily that uncommon. Many of these we might see in individuals' lives. But in development, we find it hard to articulate clearly the lack of power and autonomy which underpins this downward trajectory. And without this clear articulation, we struggle to lay out clear and coherent plans of action. That list of social norms, physical and emotional insecurity and vulnerabilities can be confusing for the policymaker. Where should they start in that long list? How are they linked? Which ones should they address? Or the policymaker commonly says these are family matters, cultural issues, and we cannot address them. So the social has for very long been seen as complex and messy and beyond the reach of policy, and to a large extent programming too. So the work we present here as a panel contests this view and attempts to provide an interlinked and comprehensive way of recognising and tackling these outcomes. I should say here that we build in this report on the work of the OECD and their SIGI index. And indeed, it's been the work of economists over the past 10 or 15 years that have helped people who work on social institutions to concretise that which they do. As Sen said, culture matters, not just because it's a constituent part of the good life, but also because it has an instrumental influence on the behaviours of individuals, firms, and governments. And as the Morrison and Yutting said, social institutions are the most important single factor determining women's freedom of choice in economic activities outside the household. We adopt the term social institutions because it's a neutral term, and I think it's very useful. We describe social institutions as being a collection of formal and informal laws, norms, and practices that have an effect on human capabilities by either limiting or enabling individual and collective agency. And social institutions, importantly, are neither inherently good or bad. They provide the social parameters within which we all, as individuals and groups, are able to develop our human capabilities. But when they result in processes that lead to inequality, discrimination, and exclusion, they become detrimental to individuals and to development. And very importantly, culture is not an untouchable and permanent fixture. Rather, it's always in flux and contested, and it's constantly being shaped by human interaction. Now, the SIGI index, the Social Institutions and Gender Index of the OECD, attempts to look at gender inequality and to measure aspects of gender inequality that they felt were not covered by current gender-related measures. They felt that the gender-related measures, the GEM and the GDI, tended to focus on the results and not on the causes of gender discrimination. which are often more related to the institutional frameworks that constrain women's economic roles. We also feel that both of these measures fail to appreciate the care economy, to make genuine links between women's representation at different levels, to consider issues such as violence, control over the body, sexuality and reproduction, or to capture empowerment at the household level. Now, the SIGI architects, in relation to the SIGI index, are primarily interested in highlighting the relationship between social institutions, defined as laws, norms, traditions and codes of conduct, and women's economic empowerment. In our report, we did modify and change, and we used the SIGI index as a starting point for us to start using what they had framed up in a very useful way, but we wanted to extend it. We considered a broader definition of well-being than just economic benefits. We cover girls, where data is available. We address inconsistencies in the labelling of the 5 institutions. We modify the component variables within the SIGI, and we want to take a life cycle approach. These are all differences from the way in which the SIGI operates. And in this way, we felt we were able to provide a linked framework of the social institutions which have negative effects on girls' well-being and human capital development. We think this approach is very useful. It actually provides concrete manifestations of the effects of social institutions which policymakers need, and they need a framework to think through these issues. It makes visible the importance of individual and collective agency and the effects of social institutions in limiting that agency. And it renders visible what can be dismissed as a family matter or as culture. And importantly now with the SIGI, aspects of it can be measured. These are the 5 social institutions that we outline in the report. Discriminatory family codes, which is about parental authority, inheritance laws, marriage practices and family structure. As you heard in Mona's story, for example, many women do not have custody over their own children and therefore endure all sorts of problems in order to maintain contact with their children. It also covers early marriage, which is a huge problem in many countries. The second institution is sum bias. This refers to unequal investments in the care, nurture and resources allocated to sons and daughters within the household. The SIGI index in particular looks at missing women mortality, but we extended this quite considerably to cover the care economy and time poverty linked to labour roles. Also psychosocial ill-being, the undervaluing of girls, which leads to low levels of self-esteem. The third social institution is about limited resource rights and entitlements, girls and young women's access to and control over land, finance, property and natural resources. This includes discriminatory inheritance systems, it includes property rights and also financial inclusion. Of course, a lot of poor people are excluded, but 75% of the world's women cannot get bank loans. The fourth social institution is physical insecurity, the laws, norms and practices which condone or fail to challenge gender-based violence in the household, school, workplace and community. These are condoned norms often. For example, wife beating as punishment is widely condoned by women themselves at 89% in Mali. But we also extend it to cover sexual abuse and harmful traditional practices, FGM cutting, but also honour killings and femicide. And our fifth institution is restricted civil liberties. This is restrictions vis-à-vis freedom of movement, freedom of association and participation in collective action. We extended this also to cover limited birth registration. 50 million children are not registered annually. Restrictions on mobility. In Pakistan, just 18% of women have ever travelled alone. And limited voice and opportunities to participate in associative groups, leisure activities, education, political and economic processes. This also includes issues around safe spaces where women can congregate. So those were the 5 institutions, which are also the 5 institutions of the SIGI index, but they're slightly different in our report from the way in which SIGI has used them. And all of these have poverty impacts. All of these institutions have effects. They underlie a set of causal processes which lead to poverty and underpin women and girls' development deficits, often denying them the personal efficacy necessary to take up development opportunities. If one focuses very much on the supply side in development, it is the demand side that often is limited. You may be providing services, but girls are not in a situation to be able to take up those services, to be able to travel, to be able to set up any sort of business opportunity, or to undertake their own education. And the poverty impacts, I won't run through them all, but just taking early marriage, for example, pregnancy-related mortality is a leading cause of death for girls aged 15 to 19. Adolescents account for 10% of births, but 23% of the burden of disease from maternal conditions. This is a huge figure, and this will stay with them all of their lives and limit their abilities. And globally, about 16 million adolescent girls aged 15 to 19 give birth each year. There are many other poverty impacts that are detailed in the report, but what I want to do now is to hand over to Nicola, who's going to talk about policy and practice interventions. I have to move as well.
Thank you very much. Our report does highlight, as Caroline has said, that gender discriminatory social institutions are deeply embedded and challenging to change. And I think perhaps this quote from a high school boy in China really captures this sentiment well. He said, reflecting on his much brighter and much more academically successful younger sister, that fate favors me and plays big jokes on my sister. So he knew he would have a lot of opportunities in his future, supported by his parents, but his sister was going to have to get married early and continue to support the parents in household work. However, I think very importantly, our report highlights that policy and programmatic change is possible and that it's happening in multiple developing countries in all regions. But on a more cautionary note, we do highlight that such change is often happening at a very small scale in the form of pilot initiatives. So although we document a lot of promising practices, many of them are very small. Moreover, strategic nationwide policy approaches that tackle the multiple dimensions of girls' experiences of chronic poverty that Caroline was talking about are really lacking. We don't have any good examples of a very strategic, multi-pronged approach at the policy level that has the kind of political ownership that's critical to really make the changes necessary. And we also found that there's significant problems with the evidence base on the policy and programmatic approaches that do exist. So the evidence base is very fragmented and limited. So knowledge management amongst the development community working on these types of issues is really weak and something that needs to be urgently tackled. Obviously the Girls Hub is one example of an initiative that's trying to address this. What we found in general was that there was a considerable amount of documentation of approaches that were trying to change different aspects of discriminatory social institutions, but relatively little documentation of the impacts of these approaches on girls' lives. So the evaluation evidence side of the equation is very weak. So what we try to do in our report is to synthesize the evidence of promising practices where there is some evaluation evidence, although we should present the caveat that often the quality of that evidence is relatively limited, with an important exception of the Population Council, and that's why we're very happy to have Wendy here with us today to discuss some of that, because in multiple regions we did find it again and again, the Pop Council coming up with some very interesting impact evaluations. But overall we would highlight that one of our key conclusions is really the very urgent need to improve the quality of evaluation evidence, and then its communication, so sharing that evidence so that people really can realize that this type of change is possible, and then what's needed to go to scale and change for the millions of girls suffering. So what we do in the concluding chapter of the report is to highlight 6 key areas of policy and programmatic action that we think are critical to make the changes needed. So the first set of changes we look at relate to legal change. And we conclude that it's essential to develop and enforce context-sensitive legal provisions to eliminate gender discrimination in a wide variety of contexts, so in the family, in the school, in workplaces, in the community. And we document a number of important initiatives around legal harmonization, so ensuring that national laws are harmonized with international commitments to gender equality, such as CEDAW or the Beijing Platform for Action, the importance of legal literacy programs for professionals and traditional leaders so they're aware of this legislation and how they might go about implementing it in practice. And then finally, complementary community sensitization efforts. So I just want to give you one example of a very interesting initiative in Ethiopia, which is trying to raise awareness about the importance in the community of implementing the law on the legal age of marriage. And this is a program called Light for Eve that's been run by the Ministry of Youth and Sport and a regional counterpart in Amhara. It combines incentives to families, so financial support, including livestock transfer at the end of their successful participation in the program. But it twins that then with regular community dialogues with community leaders and elders about how delaying girls' age of marriage can have multiple positive spillover effects, both on their life opportunities, but also in terms of their potential to contribute to the family. And a recent N-Line survey found that amongst the girls participating in the program, there had been a 7% increase in girls' schooling, that all the participants in the program had not married during the duration of it, and knowledge about sexual and reproductive health had improved. The second set of recommendations we look at focuses on the importance of voice, and we urge that it's critical to support measures to promote children's and especially girls' right to be heard and to participate in decisions in areas of importance to them. And here we review a range of different initiatives, such as girls' movements and clubs in different parts of Africa, programs to create safe spaces for girls, particularly within urban areas, gender-sensitive school curricula reform to change ideas about girls' capabilities and gender roles in the household and in public, and then also a range of initiatives that are attempting to involve adolescent girls in public policy planning and budgeting, particularly through youth municipal councils. And just one example that I'll highlight in particular, this is an initiative that's really trying to mobilize girls through promoting their participation in sport. It's an example taking place in Kenya. And here, the Youth Sports Association was expanded to include girls, but initially they found strong opposition from parents, reluctance to send their daughters due to concerns they wouldn't be able to contribute to household work or care work as they usually did, but also the risk of their exposure to unsafe places. But over time, through working with the girls and particularly with their mothers, program impacts have included expanding the gender roles available to young girls. They don't just have to be confined to daily care work and domestic work, opportunities to develop networks amongst girls themselves and gain confidence and greater self-esteem, and then also disrupting gender stereotypes so that eventually some of the girls have become active within the sports association in a managerial role, including even as coaches and referees. The third set of policy and programmatic recommendations we make relates to capitalizing on the global momentum around social protection and ensuring that there's an investment in making social protection programs, both at the design and implementation levels, both age and gender sensitive. So you're probably most familiar with the gender differentiated cash transfers to promote girls' secondary education and reduce their social vulnerabilities, public works programs that are sensitive to girls, or women's dual roles. So for example, using public works labor to reduce girls' time poverty in terms of collecting water or fuel wood, and then a range of school feeding programs and girls' scholarships. But one of the most sort of exciting initiatives at the moment is an example that the World Bank has been leading, what they've called a cash transfer experiment in Malawi. where they've focused on providing transfers to secondary school girls, both the parents and the girls directly. And they've called an experiment because it has an innovative randomized pilot design. So there's both a treatment and control sites, and in the treatment sites, some girls get the transfer with no conditions attached, and in others there are conditions. Because if you're familiar with the social protection debates, there's a very heated debate around conditionalities. And so the impact has been quite impressive. Within 2 years, they've seen a significant increase in school retention amongst participants, a decline in the age of onset of sexual activity, significantly lower HIV prevalence and STIs, and also reduced reliance on girls having to accept cash gifts to remain in school from their sexual partners. And interestingly, and I think much to the World Bank's chagrin, this particular study did not find a difference between conditionalities and the unconditional transfers. So that's obviously an interesting area for further research. Okay. The fourth set that we look at is strengthening services for hard-to-reach girls. And here we're looking at strengthening services for girls who are hard to reach, both in terms of their spatial disadvantage, being in remote rural areas, as well as the age and gender-specific sociocultural barriers that they might face. So we look at the importance of home-based or mobile services, incentives for enrolling girls in schools right from birth, and a range of mentoring programs. In terms of one particularly promising practice, and I think Magda can talk more about Oxfam's experience in this regard, we looked at a program in Pakistan that UNICEF has been supporting to increase the number of female teachers who can serve as role models for young girls who are working in schools in fragile state contexts. So this is in the northwest frontier province of Pakistan, where there are very strong gender disparities. And UNICEF worked in partnership with local authorities, teachers and parents to hire vehicles and drivers to bring the teachers to these challenging areas. So that's seen a significant drop in absenteeism, and a great increase in one district in girls' enrollment. The fifth area that we look at is strengthening girls' access to resources, both their use, ownership, and access to financial and natural resources. Here we really struggled, to be honest. We found there was a very limited evidence base identifying practices that specifically target adolescents and young women. But we did find some interesting initiatives related to microfinance initiatives, particularly targeted at girls in Bangladesh and in Kenya. And what was critical here was that they were twinned with additional social support programs, particularly around skills transfer for income generation, and then providing safe spaces for girls to socialize, because in many of these areas there are no safe sex-segregated spaces. And the impact has been quite significant. There's been a reduction in early marriage, girls' greater involvement in economic activities, and increased literacy rates. And the final set of recommendations we look at relates to promoting girls' physical integrity across the life cycle. So starting from, for instance, multimedia campaigns, trying to raise awareness about problems related to sex pre-selection practices, right through to gender-sensitive DDR programs in post-conflict contexts. And just one particularly promising practice we saw in this regard around physical integrity is work linked to engaging men through programs to rethink masculinities. And there's a very interesting initiative, Program H, that began in Brazil and has since been adapted to the Indian context, which is really focused at reshaping traditional masculinities, especially at young men at greater risk of HIV and other STIs. And also these young men tend to be more likely to perpetuate sexual abuse. So there's been very strong impacts in the Indian context in terms of changing male attitudes about appropriate sexual behavior, relationships with women, both outside of the house and then in terms of household decision making. But I know Magda can speak much more to that later. Thank you.
Thank you, Nicola. Thank you. And,